Good evening, everyone, and a very warm welcome to Liver Cancer Awareness Month. The campaign is organized by Voice of Healthcare in collaboration with Izar Pharmaceuticals. I'm Dr. Muskan Ahlawat from Voice of Healthcare, and I will be coordinating today's session. I'm very fortunate to see so many of you joining in here to learn about one of the most important organs in our body, the liver. Today's discussion is all about liver disease, its prevention, its management, and recovery. The liver quietly does many vital jobs. It filters toxins, helps in digestion, and stores energy. But sadly, liver disease often go unnoticed until they become very serious. The liver may be hidden from view, but it plays a pivotal role in keeping our bodies healthy and energized. Because liver disease often develops silently, knowing the risk and acting early can make a life changing difference. The good news is that with early awareness, timely checkups, and healthy lifestyle habits, most liver disease can be prevented or managed well. To help us understand this better, I am very happy to welcome Dr. Jeyhan Dhabhar, consultant medical oncologist and hemato-oncologist at Jaslok Hospital, Mumbai. Thank you so much, sir, for joining us today. A very warm welcome to you.
Thank you, Dr. Muskan, for having me over.
Sir, without further ado, let's begin our discussion. We'll start with very basic liver disease questions. That how would you describe the current situation of liver disease in India, and what are the common types and main causes that cause liver diseases?
So, I think the primary problem is liver cirrhosis, and which in turn is a high risk factor for the development of liver cancer, hepatocellular cancer, what we call HCC. Now, the next major question is what is the cause of cirrhosis? Why does a liver get cirrhotic? Why does it get spoiled? So once upon a time, the most common cause used to be alcohol, alcohol consumption, and it still is. I'm not saying no. It is still one of the most, you know, relevant causes. But there's a slight change in trend now that we are seeing. There is increasing number of fatty liver disease, non-alcoholic fatty liver disease, metabolic diseases that we see. So increased cirrhosis, increased liver dysfunction, secondary to obesity, diabetes, due to poor lifestyle choices. All of this has also become a major contributing factor to liver dysfunction. And of course, we cannot forget the viral etiology. The virus is the hepatitis B and the hepatitis C.
Thank you, sir, for explaining about liver diseases and how they develop, what are the main causes. So, sir, we have heard that many liver problems they go unnoticed in early stages. So, what are some early signs and symptoms that people should watch out for?
So, one of the early signs of liver dysfunction is persistent loss of appetite, weight loss, fatigue, which is not explainable by any other cause. you know an increase in your liver enzymes or your bilirubin. So jaundice is something that we see later on, but slight disturbances in your liver enzymes, fatigue, pedal edema, swelling on your legs, all of these are signs of liver dysfunction. And earliest sign that we see is, of course, unexplainable fatigue, loss of appetite, weight loss.
I think, sir, early detection is very crucial for any disease. If we detect them early, we must be able to provide some cure to them. So, sir, as you were mentioning about diet and all healthy habits that we follow, lifestyle also plays a very big part in liver health. So, how do unhealthy habits like unhealthy diet, alcohol, or lack of exercise, they also contribute to harm the liver?
Absolutely. So, talking more about liver cancer, I would say absolutely if it is detected early, it is very much curable and treatable, like any other cancer in our body, not only liver cancer. Any cancer detected early is potentially curable. The same thing holds good for liver cancer. So, liver cancer usually starts as a very small nodule somewhere in our liver, which has no symptoms initially. A patient can be living with a small liver, cancerous liver tumor, and have a normal life absolutely. So it's very important to not ignore the slightest persistent symptom. So what I mean by persistent, अगर कुछ भी तकलीफ है जो चालू ही रहता है एंड ठीक नहीं हो रहा है, एपेटाइट लॉस है, एपेटाइट के अब कुछ कारण नहीं मिल रहा है कि क्यों एपेटाइट लॉस है, व्हाई इज एन इंडिविजुअल लूजिंग हिज एपेटाइट, व्हाई इज इंडिविजुअल लूजिंग वेट, get yourself checked up, get yourself evaluated. It's very important that we don't ignore these complaints. And if we detect this liver cancer in the early stage, in the small initial stages, it's very much treatable. And of course, lifestyle plays a very important before cancer and after diagnosis of cancer also. So, leading a healthy lifestyle, that is daily at least 30 to 40 minutes of some form of exercise. It could be, a good walk, jog, cycling, maybe swimming, light weight training is very good for your overall health as well as your liver health. It reduces the visceral fat, that is a fat which is in your liver and which goes a long way in keeping your liver happy. And also for cancer patients who are diagnosed with liver cancer, who are on treatment,
Hmm.
the exercise and high protein diet is extremely important. It helps them cope with treatment better. It makes them tolerate our treatment much better. And also, there is studies and evidence which have shown that patients who have continued their physical activity, continued exercise during their treatment, have better outcomes in terms of cancer control.
Thank you so much, Dr. Jahan, for highlighting some practical tips that we can follow this season. So you were mentioning about detection. Can you highlight something about diagnostic test or some screening tests that are available for liver cancer?
So it is recommended worldwide and across various organizations. That is the European Gastric Organization, the American Liver Disease Associations. All major organizations across the world recommend screening for HCC, that is hepatocellular cancers, in high risk individuals. So what is the meaning of high risk? So in short, anybody who's suffering with cirrhosis, anybody who's a known cirrhotic, who has liver cirrhosis, who has been diagnosed with liver cirrhosis, should be screened for hepatocellular carcinoma. The etiology, the cause of the cirrhosis can be anything. It could be because of alcohol, because of fatty liver, because of hepatitis B, hepatitis C, irrespectively. There should be screened for HCC to diagnose it early. And now the next question is, how do we screen these patients? What tests should they undergo? So, what is recommended is a 6 monthly sonography, number one, and that can be coupled with a alpha fetoprotein blood test, an AFP blood test, what we call it. It's a very basic blood test. Most of the labs around the country do it, and a sonography, of course, is something that is also readily available. It's very important to get a comparative sonography done, so it is not a one point image. If there is something abnormal seen in the previous sonography, it's very important to track it. Then what is the next sonography showing? It is one particular nodule, has it increased in size? Has it changed its character? What exactly is happening? Because cirrhotic patients already have a very rough liver surface. They have a very coarse eco texture. Liver surface जो smooth रहता है वो cirrhotics में वैसे भी बहुत rough हो जाता है on sonography. So sometimes we can miss out very small nodules on a sonography also in a cirrhotic patient. So if one particular suspicious spot is seen and वो 6 महीने के बाद बढ़ गया, that is something alarming. That is why a 6 monthly regular checkup is very important in these high risk patients.
Thank you, sir, for highlighting about diagnostic facilities. So, moving ahead and talking about from a prevention point of view, what are the best steps people can take to protect their liver? Some vaccination or some healthy diets or some supplements? Can
So it's multifactorial. So we have to first, as I said, look at the etiologies. What are the causes of liver dysfunction? So first is, as I said, alcohol. Eliminate alcohol from entirely from your lifestyle. There is no safe limit कि चलो एक बियर पी लेंगे या एक glass of whatever alcohol. It
yeah.
is no safe limit. And this is not only for liver cancers, for across malignancies, colon cancer, bladder cancer, breast cancers. Alcohol has shown to play a causative role in all of these cancers. I recently authored an article on alcohol consumption in ladies and breast cancer because it's Breast Cancer Awareness Month, and there's such a strong relationship we see in alcoholic ladies and breast cancer also. So across cancers, alcohol is a major culprit. I would say it is something that we tend to ignore and conveniently say it's safe. And I'm not talking about raging alcoholics who drink every day. Even that one-off drink in a week is harmful. So stay away from alcohol at all cost. It will keep your liver healthy and also prevent various cancers. Number one. Second thing is the metabolic part of it. So that is obesity, diabetes. So the best way for that is to keep yourself active every day. If you have a sedentary job, try to get up, try to walk around. If you're in an office sitting on a chair for 8 hours, get up in between every 20 minutes, get up, take a round or two and come back. I'm sure your boss will not mind that. As a oncologist, I'm sitting on my chair full day also when I'm seeing OPDs for long hours. What I do is I get up every time once a patient leaves the cabin, I drop them to the door and come back. It's a short distance, but at least I'm getting up. So it's some form of physical activity, and of course dedicated walking every day, walking, running, something every day is very important. Third thing is to avoid ultra processed food. So something which is frozen, kept in a deep freezer for a long time, you just take it out, freeze, fry it, eat it, or something that is preserved for too long. All of this is unhealthy for our gut, and it eventually will cause fatty liver and liver dysfunction also in the long run. Fourth is the infections, hepatitis B and hepatitis C. So thankfully for hepatitis B, we have a good vaccination schedule already in place, and it's mandatory. So the incidence of hepatitis B is really decreased. And for hepatitis C, we have very good antiviral drugs. So we have almost clearance of viral load of patients getting hepatitis C negative, seronegativity after getting a good course of hepatitis C drugs. So I think these are the factors which are very important for preventing liver cancer and other cancers also.
Great. Thank you, sir, for a descriptive response about how prevention modalities can be used to prevent from liver cancer. So, sir, as a medical oncologist, how would you suggest that patients who are already diagnosed with liver cancer or some kind of liver disease, what are the medical treatments that are available?
So the treatment of liver cancer has changed drastically over the last few years. So few years back we had practically no treatment for liver cancers. 15, 20 years back, many things were tried, but nothing really worked for these patients, and they would inevitably not survive. But then, things really started changing when we identified certain tablets, that is, tyrosine kinase inhibitors, targeted tablets that work very well in liver cancer. And the initial tablet was quite, the first tablet that was found to work in liver cancer was quite harsh on the body. A lot of loose motions, oral ulcers, a lot of side effects to it. Then we had newer tablets coming in like lenvatinib, which work excellently well to control liver cancer. And then recently we have with the advent of immunotherapy. So immunotherapy has been a game changer for the management of hepatocellular cancers, for liver cancers. Immunotherapy, I have patients who are 88, 90-year-old patients also with liver cancers on immunotherapy right now. It's that safe. So there's practically no side effects like chemotherapy and what we hear of. No hair loss, no ulcers in the mouth, no infection, nothing. And we see very good long-term results with immunotherapy injections. So all of this is of course in the advanced stage when surgery or other forms of local treatment is not possible, like liver transplant is not possible, surgery is not possible. No, we have certain treatments that we do, liver directed therapies, that is giving certain injections directly into the liver, that is called TACE or TARE, so transarterial chemoembolization and transarterial radioembolization. These are all, they sound quite fancy, but when all of these treatments are ruled out, when any local form of treatment is not feasible, we have immunotherapy and oral tablets that work excellently well in liver cancers. Means I have patients doing so well on immunotherapy injections that they practically forgotten that they had liver cancer.
Thank you, sir, for highlighting about treatment options that are available, in India. Um, so, sir, as someone is going through medical treatment of liver cancer, so how important is a complete approach that they have to follow diet, exercise, and regular health checkups for reoccurrence of liver cancer?
So it's very true. I think for any oncology unit to be successful, it's not only the medical oncologist, it's not only the cancer specialist who needs to be there. We require a very good team. So,
Hmm.
luckily in our center we have a nutritionist, we have an onco nutritionist, we have a psychotherapist. Besides, of course, our chemo sisters, our oncology sisters, our entire, that's everybody else. So it's very important that besides the active oncology treatment, like I mentioned, immuno and all of this, besides all of that, it's very important that they have a clear idea of what they should be eating, what they should not be eating, because there's so much misinformation over there in this particular area, especially because everybody thinks they're an expert when it comes to diet and all of this. I have patients coming and telling me कि सर कोई मेरे को बोल रहा है कि मैं हल्दी का दूध पीऊँ या कोई मेरे को बोल रहा है कि मैं wheat grass खाऊं कि should I have this and should I have that. There's so much misinformation. Some individuals stop having sugar altogether because they believe so strongly that sugar feeds cancer cells, which is absolutely a myth.
Yeah.
Sugar is bad for everybody. I agree. It's not good for you, not good for me also. There's no direct link of cancer and sugar. So in moderation is absolutely okay. Once in a while, if my patient wants to have an ice cream or a gulab jamun, I said please have it once in a while. There's no problem. But roads nahi khana, of course. So it's very important that we get a proper rational diet plan and not something which is only of karela juice and haldi doodh and all of this. So a good healthy diet which is also pleasant to eat. Patient feels like eating it also and not something, as I said. So that is very important. Plus, it's very important to have a health coach or an oncology coach, what we call in our center, who guides the patient on all of this exercise, you know, and mental well being. This is also extremely important that if you have a positive outlook to your disease, to your treatment, you cope better. You tend to accept the treatment better, you respond to treatment better. And of course, the follow up part of it, like after treatment is over, when to come for follow up, what tests need to be done, all of this is prescribed by us, the doctors, of course.
करेक्ट। सो सर, जैसे अभी आप बोल रहे थे कि बहुत सारे मिथ्स हैं हल्दी वाला दूध एंड ऑल ऑफ दैट, वी हैव मेनी सप्लीमेंट्स और न्यूट्रिशनल प्रोटीन और some kind of powders that claim to enhance liver health or body health. So what's your opinion on that?
So, high protein diet is important, there's no question in that. And it's always best to consume natural source of protein. So, a non-vegetarian person is very easy. Eggs are there. We have chicken. We have
Yeah.
fish. We should avoid red meat at all costs. But the white meats and egg is very good. And for vegetarian patients, there is dahi, there is paneer, soya, and we tend to supplement vegetarian patients with any good authentic protein powder that is available in the market. There is no real role of any supplement. There has been a lot of studies in the past over the last so many years about various supplements that have been tried. Vitamin A, vitamin C,
Yeah.
then so many things. Vitamin E has been tried, and all of these studies have shown negative results. Have shown no benefit in cancer prevention and also for preventing recurrences. So there's no real, magic pill that we have. But yes, a healthy diet, healthy balanced diet, which is rich in protein, is important for all of us and also for our patients.
Thank you, sir, for clarifying the myths that are, circulating around in India. So, sir, moving ahead, before we conclude our session, let's do a quick myth versus fact segment where we'll answer some few common myths about liver health. So, first notion is that liver disease or liver cancer is always fatal.
That's absolutely a myth. It's not at all fatal, and no cancer is absolutely fatal. So we should remember that there is treatment, there is hope. So never lose hope, even if you're diagnosed with cancer.
So, sir, second question is related to treatment that only surgery can improve liver cancer.
So in early stage disease, if transplant is not feasible, yes, surgery is a very good option for liver cancer patients because the liver can potentially regrow, regenerate itself. But in an advanced stage, when surgery is not feasible, we have all of these treatments that I mentioned, and they work really well, immunotherapy and tablets.
Uh, I have one more question regarding for treatment, sir. So, according to you, which is the most recent advancement in liver cancer treatment that you find it is very promising?
So I think the latest combination that we have in liver cancer treatment is a combination of two immunotherapy drugs. So initially it was only one immuno and a targeted injection, or only the tablets, targeted tablets as I mentioned. Recently we have a combination of a double immunotherapy, that is, two immunotherapy drugs given together, which work very well. Also, there are a lot of newer treatment options coming in from the nuclear medicine side. So we have FAPI based treatments. So we have how we do a normal PET scan. So PET scan basically lights up the wherever there's cancer in the body, it lights up on a PET scan. So what we do in a FAPI PET is we give a different type of injection during the PET, and it lights up, the FAPI part lights up on the scan. And then we have certain injections that can be given and only going to attack the areas which are lighting up on FAPI PET. So these are nuclear based treatments which are also already being used in prostate cancers. Now we are trying to use it across other cancers also.
Correct. Thank you, sir. Thank you so much for sharing your insights. One last golden tip that you would like to give to our audience to maintain their overall health this festive season.
I think the only real magic pill that we have is physical activity and exercise. So sedentary lifestyle is going to kill us all if we continue sitting around. Get up, move around, and have a healthy lifestyle. That's all.
Thank you. Thank you so much, Dr. Jahan, for sharing your knowledgeable insights with us. It was a wonderful session, sir. Thank you so much.
Thank you. Thank you so much.